There's really a lot of frustration of what to do when a child is not developing properly. So I can't tell you how many times I've had doctors call me and say, hey, my child has developmental disorder. What do I do? And even pediatricians are confused what to do. You look at things like autism. The rates of autism are now 1 in 59 children. And this is the CDC as of 2018. So 1 in 59 children will not be diagnosed with autism. The bottom line is those children need help. These kids need help. Like, they don't know what to do. They're really stuck and they're hoping that their parents can figure something out. Children with ADHD, they have some of the highest rates of divorce, drug abuse when they become adults. They have some significant issues with healthy relationships with their friends and spouses that become compromised. If you take a look at the average elementary school, people can't bring in any foods or nuts or allergens because these kids will have a severe immune reaction, the degree of food allergies that they're dealing with now, like never before. One of the most difficult things of childhood developmental disorders is actually working with parents. It is not easy. It's no other type of clinical topic we've discussed so far. It is so unique because of the dynamics involved, of the timing to make changes before these windows of opportunities are impacted. And then the environment you have to work with, the child, the parents, other healthcare professionals involved, and how to really make all of that work. You will never have an ADHD child that has the same deficits as another child with ADHD. You'll never have a child with autism that has the exact same deficits as somebody else. So you could have a child that has a little bit of dyslexia, some anxiety disorder, some ADHD, patterns that are on this autism spectrum. There's some OCD, they have sensory processing disorders. They can't handle sound, they can't handle light, they can't handle touch. And they're nervous and scared all the time. They can't focus, they can't concentrate. And they're that unique individual. There's kids that have to rip their clothes off their body because their t-shirt hurts their skin. You could have a child that has pediatric acute onset neuropsychiatric disorder, which develops after an infection. They get an infection and the antibodies from the infection start to attack the brain and they get acute onset of symptoms. There's a whole host of things that can happen when the brain is not developing properly. So part of the things I want to make sure that you have as you complete this course are tools and a system of thinking and a system of going through the process of evaluating any children that are having any kind of developmental delays. Childhood developmental disorders sometimes become mysterious to people or to practitioners, and it's really because they just don't understand neurology. When people don't understand this neurology, they'll say, well, if you go to a kid with ADHD and say things like, if you don't follow these rules, this will happen to you. Guess what? That involves executive function. Those areas of their brain are not synaptically firing the way they need to. It's part of their deficit. Then you can get into different areas of the brain, the premotor cortex areas, and these are the areas of the brain that are involved with motor planning. So you can literally see kids that have different types of parietal lobe deficits injure themselves and cut themselves and burn themselves, trying to get some sensory input to the brain. So the limbic system is, think of it as the animalistic brain. It's going to yell, it's going to scream, it's going to do whatever it wants to do. There's kids that have activation of their amygdala and have fear and anxiety all the time. They can get an infection, have antibodies destroy parts of the basal ganglia, which dampens their limbic system. They can have those types of issues. So gravity is always causing activation and stretch of muscle spindles, and that then activates the brain and vestibular input. So they move their head and they rock and move back and forth. That activates the cerebellum. And these are the initial pathways of development. Changing them from a horizontal position to a vertical position increases that muscle spindle type of firing that helps with activation of the brain. And one of the key areas of the basal ganglia is that it dampens the limbic system. So when kids get OCD and they can't dampen their anxiety and they can't anger, they can't calm down their rage, and they can't calm down even things like vocal tics, the urge to just yell out, or motor tic, like a need to clear their throat all the time. Overnight, the kid has night terrors, and overnight the kid has vocal tics and motor tics, and overnight the kid has severe anxiety. And that's because this basal ganglia structure is being injured. So why does this matter? Because when you have kids that have hyperactivity, when you have kids that have anxiety or emotional overreactivity or abnormal movement, that means the inhibition pathways of the brain are not working. The brain is constantly getting input from gravity, from muscle spindles and Golgi tendons, from the vestibular system as we move. And the overactive response could be like a hyperkinetic movement, like a vocal tic or a motor tic, or it could be anxiety or unprovoked fear, a mother's health has a huge impact on these tracks developing in that fetal development. Why doesn't my child behave? Why doesn't my child just listen? Why are they misbehaving? They're not misbehaving. They don't have the pathways intact to sometimes even process or understand what's happening or to respond to these things. Now, when we're first born, the main pathways of our development really take place by movement. So changes of our muscle spindles and stretching and changing gravitational positions stretch these muscle spindles. They fire into the cerebellum, and vestibular input fires into the cerebellum. That's what activates and fires the brain. Neuron migration is critical, and this goes back to how important maternal health is and fetal development is. So let's talk about neuron migration for a second here. So when the brain is developing, you have clusters of neurons, and these neurons have to start migrating. They actually basically move to get to the cortical regions of the brain. Autism is happening during fetal development, way before a child is even vaccinated. Vaccines are not causing autism. Okay? Dyslexia is another condition where there's migration issues, neuron migrations. People that have dyslexia have different brains, and they have some difficulties with obviously reading, but they have some greater activities with creativity, but their brains just work differently. So conditions like autism and dyslexia are conditions where there's a failure of neuron migration during that first 12 to 24 weeks. It's really a combination of genes and environment mixed together that impact neuron migration. Breastfeeding has profound impacts on brain development the first 2 years of life. There's a big difference with children that are breastfed or not breastfed, especially that first 3-month window. But what's happening is all these neurons that were developed were not always so efficient. And as the brain gets healthier and starts to develop properly, microglia come in, which are the immune cells of the brain, and they start to clear up and destroy these pathways that go to nowhere and are inefficient. Basically, inflammation in the brain in any kind causes more pruning, and excessive pruning leads to loss of efficient pathways in the brain. But if the brain is inflamed, these microglial cells are overactive, they get excessive pruning. And that is another issue that can impact the brain architecture. So that first 2 years of window, once a child is born, are really the most important. Okay, now obviously fetal development is the key part of the healthy development in this 1 to 2 year window. If you have kids that have autism and they have some significant impairments, whether it's sensory impairments or motor impairments, if those can't turn around by the time they're 20, then it's very likely they can have those symptoms for life. If the child is eating macaroni and cheese and pizza all day, that's all they want to eat, and soda, and getting no movement and no activity, no cognitive stimulation, watching TV all day, they will have a different brain, and that brain will be set by 20. So if you see a child suffering from ADHD at age 8, then you know you have this window of time to really work through. If you see the ADHD child at age 15, it's a whole different story. So neuroplasticity means the neurons that are there can still connect and move over neurons that are not developed and unhealthy as well. So all children are first born with some primitive reflexes. So primitive reflexes would be like a sucking reflex. When nipples put in their mouth or fingers put in their mouth, they start sucking. That's a normal process of development. And these are the things that you want to evaluate as a clinician. Anything that was placed in this child's mouth, they're going to basically start sucking. There's adults that still have primitive reflexes that are not gone. You touch their cheek and they start sucking. So they're not all developmental delays. They can be a pathology that's involved. So these are cord reflexes, and the brain as it develops inhibits them. When a child is first born, they activate this cerebellar pathway. They get balance and stability. They start to be able to get intrinsic muscle activation, the ability to stand up erect. So when a child is born, it's really important to see them walk. It's important to stand erect. This is a real part of neurodevelopment. But what if the cerebellum never develops, never activates? Then you may not have proper progression and development. When kids don't have movement, they don't develop. So when you see kids that are like in front of a computer game, they're not going to develop properly. They're sitting and staring at their phone all day. The brain has to have all these inputs to develop. So when they're in a non-sensory stimulating environment, the brain just does not develop properly. So milestones are categorized into gross motor, like moving large muscles, fine motor, using the hands, language, receptive and expressive. Receptive, understanding what's happening, expressive, telling you what they're feeling, cognitive, reasoning, memory, problem solving, and then social, emotional, and behavior. So it does not alert to voice by 2 months. That's not a good sign, right? If a mom has her first child that gets diagnosed with autism, there's like a 70% or higher chance their second child will have autism. The sooner you identify patterns, then the sooner you can be more aggressive with implementation, doing things. So the bottom line is, you really want to first understand that these windows of time, so that's one of the most important things, that these windows of time for development, fetal development is really critical. In that first 2 years of life, it's critical for synaptic density, synaptic pruning, white matter development, gray matter development. And that's a window of time you cannot lose if you have a child that has risk for having childhood developmental disorder. You can look at milestones throughout this period of time, especially the first 2 years of life, to see if things are going in the right direction and see if there's any suspicion of things. So when you look at one of the biggest risk factors of why kids are not developing, a big part of it is because they're not moving. They're not getting coordination. They're not moving. They're sitting at home. Like, you have educational programs in schools that don't even have PE anymore, physical activity anymore, physical exercise anymore. So these include, obviously, receptor activation, like we've been talking about, but feeding, microbiome health, immune activation, oxygen, and so forth. I know when my daughter was born, we couldn't have friends over our house, I think, for the first 4 years, because we had a trampoline in the middle of our living room, and we had a rocking chair, and we had all these sensory stimulating things all over our house. And we didn't want anyone to come over because we had this. So there are lots of children that just don't have enough receptor activation. They go on through life, and that becomes a problem. You'd be surprised that researchers have actually proven this now with meta-analyses and multiple studies that, yeah, kids don't develop well. They're eating high fructose corn syrup all day and sodas all day. If you get a kid that can't stop eating unhealthy foods and doesn't have proper nutrients, their brain cannot develop. I'll be honest with you. Diagnosing child developmental disorders is really easy. Looking at the things that you need to do are really easy. Implementation is where everything falls apart. Their guts are completely different. There's a completely different microbiome in ADHD kids than kids that do not have ADHD. This concept of like mothers going, hey, I'm pregnant, I get to eat everything, right? My doctor said I could, is the worst possible thing that could be done. It is so critical for mothers before they become pregnant and throughout their pregnancy to have a healthy microbiome. High amounts of short chain fatty acids, high amounts of fiber, high amounts of diverse vegetables, limits of sugar, processed fats, healthy fats in their diet. So the microbiome releases different metabolites. These different metabolites turn on neuron branching, neuron signaling, neuron migration, that there's this communication between the microbiome and the brain. So having a healthy microbiome is absolutely critical for healthy development. Like an optimal, healthy microbiome of the mother is critical for healthy neurodevelopment. This isn't theory anymore. This is part of normal physiology. That's why it's so important for the mother to have healthy foods and diet all the way through development and so forth. We know that when the mother is shifted towards dysbiosis and the child then ends up with a dysbiotic gut. So if the mom is eating high amounts of sugar, high amounts of processed foods and unhealthy types of patterns, they end up with a dysbiotic gut. The kid has a dysbiotic gut. And studies show that these kids absolutely develop asthma, chronic food sensitivities, chronic allergies, intestinal disease. They're more prone to obesity. So there's this bidirectional pathway from the gut to the brain and brain to the gut. And these bacterial metabolites release different types of signaling agents that stimulate nerve growth and nerve activity. So you have to have microbiomes, healthy microbiome, healthy amounts of bacterial structures to cause neurodevelopment in the brain. Right? What they're also finding is that when the microbiome is not healthy during fetal development, children are more prone to stress responses for the rest of their life. These pathways can get ingrained into their system. So remember that the microbiome is developed from fetus to age 3. So the fetus has a sterile fetus and then initial colonization of fetal microbiome before birth by mother's microbiome. They're always hypersensitive. These probably took place the first 3 years of life. So the more inflamed the gut is, the more inflamed the brain is. Not only is the microbiome important for signaling agents, the brain to turn on signals to develop, but the more inflammation you have in the gut, the more inflammation you have in the brain. The gut's inflamed, the brain gets inflamed. If the brain gets inflamed, neuron connectivity, neuron plasticity, pathways all become impacted. and these things impact neurodevelopment. So lack of stimulation, sedentary lifestyle, nutrient-depleted food, pesticides, pathogens, oxygen, then these things impact the microbiome or micronutrients or neuron activation and neuronic responsitivity with different genes, and these things all impact neurodevelopment. So early diagnosis becomes a key factor. And as a clinician, when we see a child has a developmental disorder, we want to go, which of these variables are they missing? Which of these things need to be changed? And how do we change those dynamics?